Geriatric Diseases and Disorder lecture. The cardiovascular system is the most frequent cause of illness and disability among the aging population. Heart disease is the #1 cause of death among our population. The effects of the cardiovascular system: the myocardial cells enlarge and deposits of fat in connective tissue can affect the cardiac output, which results in a decline. This often causes heart failure and is due to edema in the lower extremities. Hypertension increases the workload of the left ventricle. Walls and veins are weakened and stretched and can oftentimes cause varicose veins in the lower extremities, which increases the risk of a patient having phlebitis or a possible DVT. Other effects on the cardiovascular system are arteriosclerosis and orthostatic hypotension. Orthostatic hypotension is caused by a drop in the volume of circulating blood. This can be a result of dehydration or medications, and can oftentimes cause syncope and falls among our geriatric population. Aging effects of the endocrine system. So this is due to a general decrease in hormone production in the hormone insulin that is produced by the pancreas. It changes in the tissue's receptor bindings. Also, diabetes mellitus type 2 is the most common cause, or the most common endocrine disorder. This disease increases the risk of vascular disease, renal disorders, retinopathy, neuropathy, myocardial ischemia, angina, CVA, and peripheral vascular disease. Treatments are oftentimes the same for endocrine disorders as they are for any other population. However, we have to be sensitive to geriatric patients, as some of the treatments for diabetes can be confusing. An example of this would be trying to teach a geriatric patient a sliding scale for insulin. We would try to do other methodologies of treatment prior to trying a sliding scale. The aging effects of the gastrointestinal system. So dental problems can decrease in taste buds and the production of saliva, and a diminishing sense of smell. A reduced appetite or dysphagia. Reduced digestibility of calcium and iron, and a decrease in vitamin B absorption. There's poor absorption of vitamins and minerals in the small intestine. There's a decrease in colon peristalsis, constipation, and diverticular disease is common. Diverticulosis is particularly common due to the lack of fiber, which causes constipation among geriatric patients. There is also a reduction in the liver function, so we have to be careful with certain medications that we prescribe geriatric patients, such as cholesterol medications. GERD is another common disease, gastrointestinal reflux disease, which commonly happens as we age, as the sphincter between the stomach and the esophagus wears. Colorectal cancers are also common among our older populations. Aging effects on the integumentary system are wrinkles, age spots, also called seborrheic keratosis, blotches, leathery or dry skin, or loose skin. The skin becomes more prone to tearing and blistering, and this is due to the dermis losing about 20% of its mass, which in turn results to a paper-thin or transparent type skin. Risk of infection increases and healing process slows, and elderly people are more susceptible to bruising. Some of this bruising can be due to certain medications a patient may be on, such as Coumadin or warfarin. Vitamin D synthesis is also significantly declined. Wound healing often takes longer, and our sweat glands as we age decrease, which makes us at a risk of hyperthermia. A decreased blood supply to the dermis increases hypothermia, and also a decrease in muscle mass will also induce hypothermia among geriatric patients. Pain thresholds can also increase due to the decrease in pain receptors, and oftentimes elderly have problems with nail splitting, which can increase the risk of fungal infections. Treating dry skin in older people, some things that we can recommend are the use of a room humidifier, bathe less frequently in warm, not hot water, use mild soaps, wear protective clothing in cold weather, moisturize, and apply moisturizers after getting out of the bathtub or shower. Shingles risk reduction. After an active chickenpox infection, typically when we are children, the virus lies dormant in the nerve dermatome. As people age, their risk increases with the virus will reactivate and cause the shingles. Most of the time, shingles is reactivated by highly stressful situations. Zostavax is the vaccine that is given to help prevent the shingles. Zostavax is a live virus vaccine, and it boosts immunity against the varicella zoster virus. The vaccine is about 50% effective and can reduce the risk by 50% in patients over the age of 60. Patients can start receiving the Zostavax vaccine anytime over the age of 50. However, it is important to note that many insurance companies do not like to cover the Zostavax vaccination, so it's important to tell patients to check with their insurance and give them a price quote of what the out-of-pocket cost would be. Aging effects on musculoskeletal system, cartilage loss and degeneration, joint range of motion decreases. Collagen is a protein that forms fibers of the tendons, ligament, and fascia, and are very important in our musculoskeletal system. Breakdown in joints and intervertebral spaces often happen among our geriatric population. Decreases in strength and speed of muscle contraction are related to activity level, so it's really important to educate our patients on remaining active, helping with mobility, dexterity, and balance, so using assistive devices such as tub seats, shower chairs, and reaching devices, assisting with gripping devices as needed, slow down the time to complete a task, support stroke victims on their weak side, especially when moving, recommend physical therapy for range of motion exercises, and encourage activity. Many geriatric patients can do some of the physical activities that everyone else can, such as yoga or water aerobics are very common among the elderly population. Osteoporosis is the primary cause of hip fractures and can cause spinal vertebral collapse. Risk factors include female gender, small bone frame, family history, estrogen deficiency before the age of 45, racial background, so Caucasians and Asians, aging, extended use of certain drugs, sedentary lifestyle, smoking, excessive alcohol intake, and the lack of calcium and vitamin D. Weight-bearing exercises, calcium and vitamin D supplements, and some other medications such as Evista, Fosamax are good examples of medications patients can take to help with osteoporosis. Aging and falls. Falls are the greatest number of injury in people over the age of 70. You are at greater risk of falling due to sensomotor changes in vision and mobility, osteoporosis, and cerebrovascular incidents. Usually results in fracture because a large percent of elderly have osteoporosis. Debilitating complications like decubitus ulcers, pneumonia, are often indicated in long-term care and can even result in death, and are often complications after a fall. Preventing falls, so having regular hearing and vision tests and getting the proper assistive devices. Understand the side effects of medications and those that may cause vertigo or syncope. If you experience orthostatic hypotension, rise slowly and stand still for a moment. Limit the use of alcohol. If needed, consistently use assistive devices such as canes or walkers. Wear low-heeled, rubber-soled shoes and avoid going outside in icy weather. Encourage regular weight-bearing exercises for muscle and bone strength. Keep hallways, stairs, and bathrooms well lit and free of any tripping hazards. Assess the home for possible dangerous areas. Aging effects on the nervous system. The brain begins to get smaller at approximately age 50 and continues to do so. However, this does not mean that there is a loss of brain cells. Typically, this is minimal in aging. As we age, we are still capable of generating new neurons to be used. Transmitting messages from one neuron to the next becomes more difficult sometimes, and older neurons process information more slowly. Reaction time is also slower, and dementia is not an inevitable part of aging, but is a result of an organic disease or disorder. Causes of signs and symptoms of dementia are often depression, reactions to medications or over-the-counter drugs, alcoholism, malnutrition, thyroid, liver, heart, or vascular disorders, and sometimes Parkinson's. Usually these are the result of dementia, not old age. Maintaining mental function is important to continue with exercise to improve memory and thinking because it increases oxygen to the brain. Keep socially active and practice stress reduction activities. Quit smoking, drink alcohol in moderation, and use hearing aids or glasses as needed. Treat health issues when they arise. Do not wait until they become untreatable. Some risk factors for cognitive decline are hypertension, diabetes mellitus, heart disease, increased stress, sedentary lifestyle, a decreased education level, and smoking and substance abuse. It is important to treat some of these and do lifestyle modification early on to prevent mental dysfunction. Some screening tools that we use in the clinic for dementia are the mini mental state examination. Oftentimes medical assistants are frequently performing these in our elderly populations. It is a 5-minute test designed to evaluate basic mental function in a number of different areas. It assesses the patient's ability to recall facts, write, and calculate numbers. It gives the physician a quick way to determine whether more in-depth testing is needed. You will find a mini mental examination example in your book, also on Blackboard, and we will also test each other in class. Alzheimer's disease is a progressive deterioration of the brain caused by the destruction of the central nervous system neurons. The only way we can confirm Alzheimer's disease is through autopsy. There is no definitive testing to see if a patient has Alzheimer's while they are still alive. Alzheimer's disease leads to problems with memory, language, thinking, and behavior, and is caused by a buildup of amyloid plaques and neurofibrillary tangles in the brain. Signs of Alzheimer's disease is repeated asking of the same questions, inability to remember common words or mixing up words when describing something, inability to complete simple tasks and misplacing items, becoming lost when driving familiar routes, sudden mood swings and for no apparent reason, and difficulty following simple directions. Treatment options for Alzheimer's disease. The goal for treatment is to maintain normal activities as long as possible. There is no cure. Cholinesterase inhibitors may be prescribed to improve the production of neurotransmitters in the brain. Medications may be prescribed to help control sleeplessness, agitation, wandering, and anxiety, and also depression. Some common medications for Alzheimer's disease that are often prescribed are donepezil and Namenda. Aging effects on the pulmonary system. Maximum lung function decreases with age. In pulmonary function testing, it will often reveal a decreased vital capacity and an increase in residual volume. Lungs lose elasticity because of the changes in elastin and collagen, and become smaller and flabbier. Alveoli enlarge, walls become thinner, and the number of capillaries are reduced. Pulmonary muscles weaken and the chest wall may stiffen. The larynx also changes and the voice gets quieter and slightly more hoarse. There is also an increased incidence of sleep disorders and often sleep apnea, which results in nocturnal hypoxemia. And these patients will either need a CPAP machine or nocturnal oxygen to treat. Aging effects on vision. By the age of 50, structural and functional changes in the eye become noticeable. You will sometimes see in elderly patients the eye socket the eye sinks back into the orbit a little bit more. The cornea also increases in thickness and also reduces in its refractive power. Lenses become flatter, thicker, less elastic, and more opaque, and sometimes may have a yellowing effect to them, which causes changes in color vision. Reduction in the size of pupils occurs, limiting the amount of light available to reach the retina. There is also a decrease in tear production, which causes irritation and excessive tearing. Presbyopia develops in the 40s, making it hard to see close up. This is the normal aging of the eye that causes problems and is often diagnosed using the Jaeger test. Aging effects also affect the ability to refocus from far to near. There is also a decreased ability to see some colors, affecting the depth perception, and this can be due to the changes in the cones in the retina or due to the yellowing of the lens. Increased sensitivity to glare and decreased response to going from light to dark or dark to light can also happen as we age. Cataracts, glaucoma, and macular degeneration are all eye disorders that happen as we age. Cataracts are the clouding or opaque areas in the lens that cause blurring of vision. Oftentimes treated with surgery where we replace the lens, or we will oftentimes do laser therapy. Glaucoma is the result of blockage of outflow of the aqueous humor, which causes an increase in the intraocular pressure that can damage the optic nerve and eventually cause blindness in patients. We often treat this disorder with medications such as beta blockers, such as Timidol eye drops. Macular degeneration causes progressive loss of the central field of vision. So there is a black blotch in the middle of their central vision, but they can see everything out to the sides. There is no cure for this type of disease or treatment and can lead to total blindness eventually. Helping the visually impaired. Allow patients to place hand above the elbow and follow your movements and feel secure. Use high levels of even glare-free light. Ask the pharmacist to use large lettering on medication bottles. Use non-glare paper and large print for forms and educational materials. Make distinct differences for pills that are similar in size and color, and place all objects with a visual field and prevent clutter. Oftentimes we recommend that patients with visual impairment set up pill boxes so they take the correct pills at the correct time. Aging effects on hearing. So things that can affect hearing as we age are impacted cerumen, otitis media, otosclerosis, which is the narrowing of the ear canal, Meniere's disease, and ototoxic drugs such as aspirin can affect hearing. Lack of attention when addressed or inappropriate response, asking to have statements repeated, and speaking too loudly or too softly often are signs of hearing loss. They can have a profound psychological effect on aging people, causing depression, social withdrawal, and feelings of isolation. Presbycusis is associated with normal aging and causes a decrease in the ability to hear high frequencies and decimate sounds. Tinnitus is the ringing or buzzing in ears that can often occur, and this is very common with patients who have Meniere's disease. The Geriatric Depression Scale is a screening tool for depression. Includes questions for patients about daily activities, interests, and feelings to help diagnose depression in the ambulatory care setting. And as of recently, we don't always just screen geriatrics for depression. According to Meaningful Use, we have to screen patients for depression at least yearly, and sometimes more frequently if they've had a history. So usually when you are doing your vital signs in the office, there will be a question on your EMR that will trigger you to ask the patient whether they've had any symptoms of feeling down, depressed, or hopeless. And if they answer yes, then that will open up to a whole questionnaire, which is the Depression Scale questionnaire. Helping hearing impaired older adults. So stand in patient's direct line of vision and gently touch the person to get his or her attention. Oftentimes these patients like to read lips to help them interpret what is being said. Use gestures, pictures, and large bold prints to communicate. Talk in short sentences into the ear with better hearing. Do not increase the volume of your speech. This also raises the frequency of the voice, which is why most people cannot hear. So lower your voice and slow down. Avoid all background noise. Also helps your patients. Aging effects on taste and smell. The ability to taste and smell declines subtly. Foods frequently taste bland and unappetizing, so patients, we often warn them on adding salt to their food to make it more appetizing. A lot of heart patients or patients with hypertension, we actually tell them to eliminate as much salt as possible. So we warn them against the increase in salt intake to make food taste better. Or we also warn patients, because they will sometimes increase their sugar intake to help make things taste better or are more appetizing to them. And we have to warn patients that have a history of diabetes that this is not encouraged. Decrease in sense of smell accompanies and decreases in taste and exposes a person to environmental dangers such as gas leaks, smokes, and other dangerous odors. Nutrition status and screening should be part of the routine primary care to identify nutritional deficiencies and correct them, which could include oral health, which in geriatric patients, dentures are very common, so ensuring that they fit properly. Gastrointestinal complaints, many times geriatric patients or older adults become intolerant to certain foods. A good example of this would be lactose intolerance. Sensorimotor changes, which we just discussed, and dietary influences. Can they afford food? Do they have the ability to go get food or go shopping for food? Social and mental influences, depression, loneliness often play a part. The most effective method in assessing patients' nutritional status is through a comprehensive patient interview that considers all potential stumbling blocks to adequate nutrition. And a lot of times patients don't understand how to read food labels and assess the nutritional value. So we encourage whole fruits and vegetables for patients, and sometimes we will teach them about reading food labels. Aging effects on the urinary system. The kidney loses about 20% of its mass, and the number of functional nephrons also decreases. Blood flow to the kidneys is also reduced, and the kidneys are less efficient at filtering waste from the blood. More diluted and less concentrated urine often occurs. Medications take longer to be removed from the body, which increases the risk of toxic level of drugs. The urinary system has a thickening of the bladder wall, which reduces the bladder's ability to expand. Increased frequency of urination and urinary retention can occur. Reduced time between awareness of the need to void and involuntary urination, also called incontinence, can happen. The loss of muscle tone in the urethra often happens, and pelvic floor muscles in aging women relax as a result of decreasing estrogen levels to previous pregnancy and childbirth. We oftentimes will try and use medications such as oxybutynin, or we will recommend pelvic floor exercises such as the Kegels exercises. Aging effects on reproductive system. So females, the vagina diminishes in width and length and becomes less elastic. The cervix, uterus, and ovaries decrease in size, and the vaginal secretions decline. Many times, women often complain or have complaints of vaginal dryness, where estrogen creams may be prescribed. Bacterial and yeast infections also may occur. Aging effects of reproductive systems for males. Sperm production may decline in men over the age of 50, but men remain virile into old age. It takes longer for the penis to become erect, longer for an orgasm to occur, and longer to recover. Changes in hormonal levels of testosterone and changes can affect the prostate gland. The prostate can potentially enlarge over time and press down on the urethra, causing difficulty in urination. Some medications that patients may take to help with erectile dysfunction are Cialis, Levitra, and Viagra. Oftentimes, erectile dysfunction in men is caused by medications. The biggest culprit of medications that cause erectile dysfunction are heart medications such as beta blockers. Sleep disorders, which include complaints of sleeping difficulties that often increase with age. There is a lack of sleep that can result in restlessness, disorientation, thick speech, and mispronounced words. It can also be confused with dementia. There are many disorders that can contribute to sleep problems. Some are sleep apnea and PLMD, which stands for periodic limb movement disease. Oftentimes, sleep apnea is treated with a CPAP machine, and also a lot of these patients have problems with overweight or obesity, so they are on lifestyle modifications. For periodic limb movement disease, sometimes medications such as Requip or Mirapex can be prescribed to help with these limb movements during sleep.